So welcome to the podcast. I'm very excited to have Murat Uralkan from Houston Methodist, Director of Transformation. Thanks for being here.
Thank you very much. It's a pleasure to be here. Pleasure to be at Vive. Pleasure to be in good company with Syllable.
In person, right? It's
in person. Right. We're face to face. Still takes me a while to check my face and what I have a mask
You look
on.
in the mirror. It's like, is that really me? Right. So tell me a little bit about yourself and your journey at Houston Methodist, and sort of what attracted you to this whole concept of transformation in healthcare.
Sure. So I'm the Director of Innovation at Houston Methodist. One of the things that we do is we focus on transforming our business from within. We're focused on disrupting our business from within. Sometimes when people talk about transformation, they kind of dilute the term. We want to be really cognizant of that, but I mean, what we're doing is transformation, and sometimes it is rather slow, sometimes it is really fast. But my journey at Houston Methodist started now almost 8 years ago. Houston Methodist has an office in Dubai for our Houston Methodist Global, and we do patient services, advisory, and education overseas as well. So I was in that advisory service about 3 years, and I came to Houston, Texas, Houston Methodist as the administrative fellow. And about a year in, we were working on a presentation with who's now the Chief Innovation Officer, Roberta Schwartz. I was her fellow. And it was about transforming, actually, and transforming what's coming next. And then that presentation turned into a strategy document. That strategy document turned into a department, and I was the hire number one for the Center for Innovation. So since then, about 3.5, 4 years, I've been now doing that, and I'm in that role.
That's awesome. So, do you enjoy it?
I do. I do enjoy it because it gives us this sense of we're doing something to not just, Houston Methodist has this tagline, leading medicine. And one of the things that we had to convince people to say was, you can't just be leading medicine and just lead in drugs and therapies, surgical procedures. You have to lead in digital services as well. So we're kind of putting that into our DNA as well. We have a long history of innovation, but digital was not sort of in that vocabulary, so we're adding that, and so that's why I really enjoy my work.
When I think about innovation and transformation are kind of wooden terms. I think that we each have our own definition, perhaps, of what that is, but as I think about it within the healthcare space, and I did a lot of work around primary care innovation and transformation, is that it always seemed to come from not necessarily a natural evolution of the practice of medicine or the delivery of healthcare services, but it seemed like we were trying to fix something. So what I like to ask all of my guests is, do you think that this innovation and transformation movement is fueled by a fact that healthcare is broken, or do you see it in a different frame?
I probably have two answers for you. I'll start with why we started this innovation and transformation journey, and our thinking was around that. And everyone has a COVID story.
Right.
We have one too, as it relates to our initiatives as well. But let me just start with before COVID. So this is when we were thinking about innovation in 2018. Innovation and transformation. I think we sometimes use that a little bit concurrently as well. We looked at what was happening outside healthcare, and we realized that someone is going to disrupt our business. And when you see disruption in yellow cabs being transformed by Uber, Airbnb is disrupting the basically
right.
hospitality industry. So we were seeing similar trends, and then we said, you know what, this is going to happen in healthcare too. And when they come into healthcare, these others come into healthcare, they're not going to go after the most capital intense, most difficult things. They're going to go with high margins, low capital intensity, and they're basically going to take away our profitable part of our business, because those profits fuels innovation in the medical field, fuels our education efforts, fuels our research as well. So if we don't have that, we have the saying that no margin, no mission.
Right.
We said we were going to be Ubered. So we said, are we going to be Uber or are we going to be Ubered? And that was sort of our thinking. I think COVID, so we embarked on that journey that way, and that thinking is still there. But COVID, I think one of the things that it has done for the industry is, for the provider side, it pushed us to our limits with the staffing shortages, supply shortages, all that, and no one was prepared for it. So that transformation is now inevitable if you want to survive. And sorry for this very long answer.
No,
but
it's great. One
One last thing. When I think about, is healthcare broken, right? You and I had a quick exchange about that. I started thinking, and my answers have changed as I start thinking about it. I think healthcare is broken in parts. Probably everything that is not a provider, a human touch, is broken. Like we showed, there's still compassion, there's still care, and people really care about taking care of others in healthcare. That part is not broken, but when you overburden these individuals with administrative things, with paperwork, with calls that they have to answer in the middle of things, clicks they have to do on the EMR, that breaks that human interaction as well. So I think there's, at its core, healthcare is not broken, but it's all the other things that we add sort of breaks it apart. And that's where I think our partnership with companies like Syllable and other automation partners come in, because we see that as removing unnecessary things from humans, because that human touch is so important. Let's remove everything else that is unnecessary to them.
So are staffing shortages your top 3 challenges right now?
Yes, I would say, I think it's fair to say it's number 1 at the moment.
Okay.
And it's not getting any better.
And are solutions to that on your innovation agenda?
We are looking for solutions for that, and it's not that immediate. So when you think about what a person does, they might be doing 50 disparate tasks. So you have to think about every little of those tasks and try to remove that as much as possible.
What are your big challenges in terms of pushing an innovation agenda internally?
I mean, internally, the change and buy-in, I think everyone is going to say the same thing. That is one of the most difficult things. Convincing people that this is actually going to help them in the long run is a challenge, because immediately you're disrupting them. And some of the technologies that we put in place, or some of the new ideas that we're proposing, they're not immediately that efficient. You have to learn new workflows, create new things. So there's sort of that learning curve, both for the technology vendors and our operators as well. So that change management is probably one of the key things. On the technical side, I would say integration has been the biggest headache that we deal with.
I'm assuming you mean software integration?
Yeah, software integration.
Do you feel like vendors are not are a bit tone deaf when it comes to the concept of integration, or is it that they're overselling how easy the integration will be, or is it that there are internal controls that make integration difficult? So
I'll go kind of in order. They're a little bit overselling from time to time, right? So overselling is definitely, they're overselling that capability, and also the systems they integrate with. They hold the keys sometimes, and they dictate to terms.
Right.
Literally, they dictate to terms. And then when you add all of that, of course, that creates internal resistance as well. So I think the job is for the people who hold the keys to realize that unless they allow for this sort of broad spectrum innovations, they're going to go out of business at some point as well. It's not I think Microsoft done that they turned themselves into a better platform instead of holding the key.
Yep.
And that transformation helped. So I think probably healthcare EMRs have to go through something similar.
What kind of advice would you give to vendors? I mean, there are hundreds of digital health vendors here. If they put you on a stage for 15 minutes and say, please give us some advice on how we can work better with you, what 2 or 3 things would you suggest to them?
I mean, one thing that you said, not overselling integration is probably a good point, but to me that comes with a deeper understanding of what that system is, right? Because we're going to be very different than another hospital that has a different EMR. We're in Houston, Texas. We're dictated, some of our business is dictated by rules and regulations in Texas. And Texas, for example, is not a huge risk market, just by the way that Medicare and Medicaid works in the state. So if someone comes to us with a lot of talk around risk, we first need to gauge that, because that's not, unfortunately, it's not a huge part of our business. So learning the companies is important. Understanding their challenges is important. And also, and I have huge respect for founders, innovators, and vendor partners that come and talk to us, but sometimes their solution is just not good enough. And last thing I want to say about that is, if we have a system in place for your product that is competing with that, if we want to make that switch, your product needs to be better than 50% more than the existing system. It's very difficult to replace an existing system. If you're coming from like ground zero, of course, that conversation is a little different, but understanding whether you're replacing something, you're coming into a green field, I guess if I have to boil it down, a little bit more research would probably help. Right.
I mean, it's got to be hard for you. You must be getting pitched consistently, or being pitched to be pitched. So your inbox is probably filling up with people trying to talk to you, and acquaintances calling you and saying, "Hey, you got to talk to this company." How do you? Are there things that you do to filter, sort of the noise from the signal?
I don't read my emails.
Yeah.
That's my biggest.
That's good.
That's my biggest filter. No, but like, I give people my email, or they find my email, and then they're like, "Oh, we couldn't reach you," and I give them my phone number. I think at some point in the near year, I'm going to change my number so that we'll figure it out.
Right.
But we started to become a little bit more deliberate. The approach that we take to innovation transformation is, as much as it is strategy driven, it's also opportunistic as well. But now that strategy component is growing. And the reason I'm giving this huge intro is, now if you're not aligning with our strategy, I just tell them that it's not on our mind at the moment. So apologies for that. But the opportunistic part of me wants to continue to listen, because my biggest fear is missing something that is happening in the market that could make a big change, because getting in early on those type of engagements is huge, and it's vastly important.
Yeah, I really like how you frame that, and I'm going to play it back to you slightly differently, in that I think having a strategy is absolutely important, because it helps you do one thing that we don't do very well. Physicians in particular, who end up in administrative roles, we don't know how to say no. And basically what you said is, I have a strategy that sort of tells me yes, and so anything that doesn't fall into the strategy, it's very easy to say no to, because there are phenomenal ideas out there, and they're phenomenal solutions. But if you're not planning to do it, if there are 3 steps that needed to be done before you're like ready for this solution, and you get distracted from it, you end up not executing on anything, because all you're doing is evaluating potential solutions, starting pilots, and then realizing, you know what, there were 3 other steps we needed to do before we thought about this solution. So I really like your approach.
But I want to sort of tag along to something you said. That distraction. So I'm kind of learning in my role, and as our department and innovation efforts grow as well, that distraction or being focused is becoming much more important, because if we try to tap into everything, then things that we're making huge bets on that we're not going to make enough of a leadway with those, so it's going to do a disservice to us. It's a mindset change, because I mean, again, that opportunistic part is still very important, but at the same time, that focused deliberation is going to be the key, because we really want to excel in certain areas.
What excites you about your work?
What excites me about my work is, for me, the best day, if I have to think about a best day, is something that a person, if they said no vehemently at the beginning, and then they one day they say, you know, I'm so glad we've done that, or hey, can we call that company to do something else with us? We think that they can pull it off. That to me is the best day. Like, turning those naysayers into yays is that is the best day of that I can have in a.
Do you have a specific example of that?
Syllable is one of those. Yeah.
That was not meant to be a loaded question.
No, it was not meant to me. But no, because like at the beginning, because this presented a lot of change, I think our telecom team's thinking was a little bit more resistant for good things, because we have a VP of shared services. He oversees telecom as well. And he said, I can afford to lose internet. I can't lose phones. So they better be up there that they can deliver. So that sort of like redundancies, all that. But I mean, you guys pulled it off. So and the other day they came back to us. When I say other day, a couple months ago, and they said, can we bring them in for A, B, C, and D? And you know, that was a great day. But the care pathways work that we've done with our physicians, clinicians, is it required a lot of standardization, and they were opposed to it.
Right.
But now they're seeing the impact that it is making to reducing calls, improving outcomes, and overall engagement, because their patients get out from the hospital much earlier. They have lower length of stay. They have lower readmission rates. I think physicians really want to see that outcome, especially if we think about physicians. And now they definitely switch back.
Many of the people that I talk to have gotten into these kinds of roles in healthcare because of either personal experience in healthcare or a relationship to a personal experience, like a family member. Is there any seminal event in your past that...
My story is pretty simple. My dad is a surgeon. I grew up around hospitals, around his clinic. I mean, that was my Saturdays, just going into his clinic and waiting and just, you know, play in his office
and watching,
in between patients. So grew up with that experience, and I cannot see sight of blood. So I had to... So
the OR was not for you.
OR was not for me. So I had to, like, I still want to be in healthcare. It was sort of like ingrained in me, but I couldn't be in the clinical side. So that's how I found that I could make a difference that way, being on the other side of the fence.
Great.
So.
And do you come to a conference like this? I know you guys had a big presentation. What else are you looking to get out of coming to a conference like this?
Again, and sorry if I'm sounding like a broken record, but like understanding where the market is heading, where others are thinking about things, is really important to us, because we cannot transform or disrupt our business from within if we don't know what's happening in not just in healthcare but other industries as well. So for me, the big thing about this conference is seeing all the technology partners, seeing other providers, and understanding what they're thinking. So far, my focus have been on just keeping an eye on what's going on around the industry.
So when I used to practice as a hospitalist, I tell a story to folks that healthcare has a problem with cynicism. And they're like, well, what do you mean by that? And I said, well, when I was a hospitalist, I used to get a phone call from the hospital administrator when the beds were empty, complaining that the beds were empty. And then when the beds were full, I'd get a phone call from the hospital administrator, unhappy because the beds were full. And I said, why are you unhappy that the beds are full? So you got to discharge faster because we've got patients lining up in the emergency room. So one of the things that I learned in joining a technology company is that there's this whole class of people that we call technologists who are incredibly optimistic about the future and optimistic about problem solving, which I think is the complete antithesis to sort of the culture of healthcare. So I'll ask you: are you optimistic about the future of healthcare, or are you pessimistic?
In my personal life, I would say that I'm a pessimist, but when it comes to my work, I'm much more optimistic than many people. I think it comes with a healthy dose of skepticism, but I think overall I would actually land on that because, think about when we give a tour in our tech hub. So we have a room dedicated to home of the future.
Yep.
And to many of the people who are in this conference, it might look like it's not that futuristic, but if we pull someone from the street, they'll say, "Oh my God!" But one of the questions that I often get asked is like, "Is this really going to happen?
Mm-hmm.
Like, do you really think that remote monitoring will be there, biosensors, this, that?" And my answer is, think about your cell phones. All of you have a cell phone. They were not a thing in 20, 30 years ago with this kind of widespread.
Right.
And it's not. And I think probably I don't have the statistics. It would be interesting to observe that. But we call them cell phones or mobile phones, smartphones. Probably the thing that we do less is actually talking to people.
Right.
They now are like your personal assistant, email, this, that, personal computer for a lot of people like that.
GPS.
Yeah,
right.
when you think about all that transformation that happened on that single device, I think you have to be optimistic that there are going to be leaps and forwards in healthcare too.
If you had an administrative fellow, and this will be the last question because I know you got to get going. So if you had yourself as the administrative fellow who was sort of like wanting to learn from you about, this whole idea of innovation in healthcare, and they kind of liked the mission of healthcare. They had a pretty good analytical mind at wanting to analyze processes and things. What types of advice would you give your 2 or 3 year old self about how to be successful in this innovation in healthcare world?
One thing that really helps people is understanding enough of how a business works, but also not know it too well that you're going to start just poking holes in every new solution. So, spending a day, a week, a month in on the floors, helping nurses, helping patient care assistants, helping supply chain people, looking over the people's shoulders who's answering phones, understanding like what healthcare business is pretty critical. I could have probably done more of that a little bit, but I really liked what technology, innovation, transformation was doing, so I kind of like steered to that direction. But understanding that is incredibly important because then you will understand where your solution fits. But again, you shouldn't go so deep that you start only thing that you start seeing is just seeing problems and why it wouldn't work. And it's similar to what you were saying about being skeptical, right? Like beds are empty, beds are full. Understanding, I don't think that people should just be blinded by what they know, and that's probably a difficult thing. And it would be a constant reminder to myself that, okay, let's see if we can make it work.
Right.
See if it will work.
Right.
So
I know I said that was the last question, but I do have one more for you.
Please.
So, can you think of a healthcare experience that you have had that was exceptional?
Yeah, and I have a couple different answers to that. And I'll dive to my personal experience. So I'm from Turkey. My dad practices in Turkey. Anytime I go to a hospital with him, it is this smooth sailing experience because people know him. He already arranged the schedules. They know me. And like you're known the
Right.
moment you walk in, and that is an incredible experience. That's actually one of the things that we're trying to deliver here with our Know Me mission, because we want to know people the moment they walk in through our doors, or maybe the moment they start like looking on our webpage
Right.
for scheduling something. So that is probably the thing that I'm thinking about delivering. When I come to this side of the ocean, my virtual experiences have been virtual care experiences have been actually great. I didn't know that you could. I think Zoom proved us, Zoom, Teams, whatever you call it, through pandemic, proved us that you could be efficient as well. But delivering that on a physician at a care level, I had great experiences with my primary care physician because I was getting worried about something about blood pressure, and we just couldn't find the time for me to leave the office, go to her office, do this, do that. And then she said, "You're my established patients. I can do a virtual care with you." And then it's there. And then you talk through a lot of the things. So
that gift of time is such a satisfier, I think.
It is.
Or the corollary. The fact that we don't respect patients' time so much is a huge dissatisfier. And I think about it, and I know I was a provider. People would have a 10-15 appointment, and I'd be a half hour late because I was spending a little bit more time with you because you needed some more of my time. And sometimes, human interactions in a healthcare setting don't jive with an every 15-minute appointment schedule, right? And I think that we just sort of said, listen, I'm being held to this artificial schedule of seeing patients every 15 minutes. And, if you're going to be my patient, you need to understand that sometimes I'm going to be late to see you. And every once in a while, I think people will get that. But I think by and large, people now expect that we will, or will expect to hold us to a higher standard.
Let me, this is why I'm always late to places as well, because I'm like, you know what, I have one more question. Let me ask you a question. And how do you think about this? So I've seen this observing providers, my family members, my dad, all that. I mean, they care for people, but because it is something they do over and over and again, and there's this natural, and I'm not saying this in a judging way, there's this natural insensitivity or toned down sensitivity. But to the patient that walks into that door, it is the most important event of their day, or their stay in that hospital is probably their most important event of the year because they're going through so much. How do you feel about that? Because then, you just said that and it made me think about that 15-minute schedule doesn't fit. And what probably distinguishes between a good physician and a great physician is understanding, okay, this patient is nervous. Let me sit down. Like, how do you, from your experience, put that human touch into care?
That's a great question. You should come host my podcast. So I really recently just started to rethink the answer to that question after I've talked to a couple of people about this podcast, because one of the very common comments we will get when we go in to do a sales presentation. So, we're a conversational AI automation company. So what do we say we do? We say we answer the telephone. Well, healthcare is so much of historically has been a human-to-human contact experience, and healthcare marketing believes that that's essential for empathy and essential for brand. And so the playbook has always been, if you need to talk to a patient, it needs to be another human being, regardless of whether we've trained that human being to be the appropriately empathetic and skilled person that they need to be. And so the comment that we get is, I don't think our patients are going to want to talk to a computer. They don't want to talk to an AI. They want to talk to another human being. And my response to that is, I can understand that if it's a complex scenario or if it's an emotionally charged situation. But if you're just a person looking to get a refill of the prescription, get transferred to their doctor's office, pay a bill, or schedule an appointment, if you have to either wait on hold for 20 minutes and then go through a 30-minute registration process on the phone with somebody, with some offshore call center, and then get invited to schedule an appointment, that's showing a great deal of disrespect to the human being on the other end of the phone. And the reason that your telehealth comment resonated with me is I believe that by giving people back the gift of time, you're actually demonstrating empathy by saying, I respect you and I respect your time. So the long-winded answer to your question is I think we need to rethink the total end-to-end process of care and figure out where can we become more efficient so that our higher-trained human beings are really only doing their higher-trained functions, and we've done a really good job at automating all those things that really could be done by a computer better than a human being. And it's been shown time and time again, if I see you in the hospital If I sit down on your bed or I sit down on a chair next to you and I only spend 2 minutes with you, your interpretation of the amount of time that I've spent with you is actually magnified to the point where they say, oh, I think the doctor was here for 15 minutes. So I don't need to spend 15 minutes for you to think it's an hour. I just need to spend 2 minutes with you. And if I can be freed up for those 2-minute aliquots of relationship building with patients, patients are going to feel like they have a better experience.
And that is our automation approach, right? Remove those redundancies so that when there's a human touch is needed, that touch is available.
Right.
And what the answer that our marketing told us, or our internal consulting team told us, that I don't like to speak to a bot. And I said, would you prefer on like 20% abandonment rate, so that 20% of your patients can't even get a hold of someone? Or you know what, everyone gets a hold of someone and they have the option. I think it's also important to give the option as
absolutely.
well. And if they want the option, they're going to press 0 and then they're going to dial. But then maybe next time they're going to give it a go because their need is much more simpler. But I think that automation around human empathy, human touch is important, and that's what we hope to deliver in our effort.
Murat Uralkan, Director of Innovation at Houston Methodist, thanks for taking time with us.
Thank you. This was so great. Thank you.
Really appreciate it. And I'll take you up on coming down and either doing it live or we can do it by distance.